Hello friends, welcome to my channel. Today we'll be concentrating on some basic or common terminologies in oral pathology. So let's get started. The first term which we are going to learn today is the word lesion. What is a lesion? A lesion is a generalized term used to refer to an altered tissue. It could be any alteration in the tissue or any deviation from normal, be it in shape, size, or color of a lesion. It could be above the level of the mucosa, below, or at the same level of the mucosa. It could be an abscess, it could be a growth or a swelling, it could be an erosion. Now, based on the level of the lesion compared to the normal mucosa or adjacent mucosa, the lesions have been divided into three categories. Those are lesions below the level of the mucosa, lesions at the same level of the mucosa, and lesions above the level of the mucosa. This categorization is not only based on the origin of the lesion but also on the progression of the lesion, like it could be upwards or downwards or inwards or outwards. So let's first deal with the lesions below the level of the mucosa. Under this category, first we are going to deal with the erosion. Erosion, by its definition, is a loss of epithelium above the basal layer. This is a basal layer or the basement membrane. This is our epithelium. As you can clearly see over here, that there is a discontinuity or a loss in the epithelium above the basal layer, leaving a denuded surface. This is erosion. Coming to the next lesion, which is present below the level of the mucosa, is an ulcer. Ulcer is a discontinuity in skin or mucous membrane with complete loss of epidermis and possible loss of dermis. As you can clearly see over here, this is an ulcer. This first layer is the epithelium. The second, this is the basement membrane or the basal layer. As you can clearly see, that ulcer is extending up till the connective tissue beyond the basement membrane. Example is an aphthous ulcer. This is a picture of an aphthous ulcer. Coming to the next lesion, which is present below the level of the mucosa, is abscess. Abscess, it's an acute or chronic suppurative process. Now, what do you understand by the term suppurative process? It's a process which results in the formation of pus. It's a localized collection of pus. This is very important. Abscess is always localized. Localized collection of pus in a cavity formed by disintegration or degradation or necrosis of tissue. Example is dental abscess. As you can see in this picture, this is a tooth which might get decayed, resulting in pulp involvement. This is an abscess or pus-filled cavity. Now coming to the next lesion which is present below the level of the mucosa is cellulitis. Cellulitis occurs if abscess is not treated. Long-standing abscesses can lead to cellulitis. Now what is cellulitis? It's also known as phlegmon. It's a diffuse inflammation. If you remember, abscess was localized, whereas cellulitis is diffuse. Abscess can lead, if abscess spreads, which it mostly doesn't, but if it's spread into tissue spaces, it leads to cellulitis. It's a diffuse inflammation of soft tissues which is not circumscribed or confined to one area. It tends to spread through tissue spaces and along the facial planes. Like for example, over here, let me show you. This is an abscess. We have muscles in the cheek region, and if the abscess it gets spread from this area and between the tissues, between the muscle or the tissue spaces, it can lead to cellulitis, which resembles something like this. It is not localized and it's very painful and tender. Now coming to the next lesion which is present below the level of the mucosa, we have endophytic nodule. Endophytic nodule is a growth of a nodule or a swelling or lump within the dermis, but the overlying epidermis is unchanged. You won't find any difference in the above epidermis or the epithelium. It's unchanged. Next lesion which is present below the level of the mucosa is a cyst. There are two universal definitions of cyst. One which was defined by Kramer in 1974. He defined the cyst as a pathological cavity having fluid, semi-fluid, or gaseous contents that are not created by the accumulation of pus, frequently but not always lined by epithelium. Whereas Kylike in 1966 defined cyst as an entity which constitute an epithelium-lined sac filled with fluid or semi-fluid material. Example are radicular cyst or dermoid cyst. Cyst is something which is lined by epithelial cells. If it's lined by epithelial cells, it's known as a true cyst. And if it's not lined by epithelium, it's known as a pseudocyst. In the next category, we are going to see the lesions which are present at the same level of the mucosa. Under this category, first we are going to deal with the term macule. A macule is a circumscribed alteration in the skin color which is less than 1.1 to 1.5 centimeter in diameter. The skin surface is neither elevated nor depressed in relation to the surrounding skin. The surface is smooth. Here you have an example of a macule. It's 1 to 1.5 centimeter in diameter. It's nothing but change in skin color. The next lesion under present at the same level of the mucosa is a patch. A patch is a larger form of a macule and is greater than 2 centimeter in diameter. Here you can clearly see the difference between macule and patch. Patch is greater than 2 centimeter in diameter, whereas macule was 1 to 1.5 centimeter in diameter. In both of the lesion, you will see color change. Now coming to the third category of the lesions is the lesions above the level of the mucosa. Under this category, first we are going to deal with the term papule. What is the term papule? It's a small raised or elevated palpable lesion which is less than 0.5 centimeter in diameter. Here you have a diagram of a papule. This elevated palpable lesion is mostly round in shape and it measures less than 0.5 centimeter in diameter. Now coming to the next lesion present above the level of the mucosa is a plaque. Plaque is a raised or elevated palpable flat lesion. You remember the previous lesion, papule, was round in shape, whereas plaque is flat in shape and is greater than 0.5 centimeter in diameter. This is a plaque. As you can see, it's a flat elevation. Papule was less than 0.5 centimeter in diameter, whereas plaque is greater than 0.5 centimeter in diameter. Now coming to the next lesion under this category of the lesions above the level of the mucosa. We have exophytic nodule. We have already studied the endophytic nodule. Now coming to the exophytic nodule. It's a swelling or enlargement of a papule in 3 dimensions. As you can see over here, this is a picture of an exophytic nodule. There is growth in length, breadth, and height. This is an exophytic nodule. Now, difference between exophytic and endophytic nodule is that endophytic nodule shows no changes in the epithelium. There are only changes in the dermis, whereas exophytic nodule, it grows in such a way that you can visibly see it. You can visibly see the differences on the skin. Now coming to the next lesion under this category of lesions above the level of the mucosa, we have blister. Blister is an accumulation of fluid either within or below the epidermis and mucous membrane. It is divided into vesicle and bulla based on the size difference. Remember, blister is not pus filled. Under blister, first we'll deal with the term vesicle. Vesicle is again fluid filled but not pus. Clear fluid, it could be a transudate or an exudate. Mostly it would be a transudate. That is less than 0.5 centimeter in diameter. It's less than 0.5 centimeter in diameter. This is a picture of a vesicle. Now coming to the next category of blister, we have bulla. It's the same thing. It's elevated fluid filled blister containing clear fluid that is greater than 0.5 centimeter in diameter. This is bulla. It's greater than 0.5 centimeter in diameter. The difference between vesicle and bulla is only based on the size. Vesicle was less than 0.5 centimeter, whereas bulla is greater than 0.5 centimeter in diameter. Now coming to the next lesion under this category of the lesions above the level of the mucosa, we have pustule. A pustule is a circumscribed elevation of the skin, or it could be within the epidermis or in the dermis, that contains a prudent exudate. What do you understand by the term prudent exudate? Prudent exudate means pus filled or infectious exudate. And what is an exudate? I'll be dealing it in detail in my coming up slides. So it contains prudent exudate that may be white, yellow, or greenish yellow in color. Here you can see a clear picture of a pustule. It's pus filled. This is pus filled. It could be either in the epidermis or in the dermis. Now coming to the next lesion under this category of the lesions above the level of the mucosa, we have crusting. Crusting is nothing but after you get an injury, over a period of time, it gets thickened and darkened, and it becomes a swab and it falls off. That is crusting. Crusting results when serum, blood, or purulent exudate dries, and it's a hallmark of pyogenic infection. Now there are various changes in the color of the crusting. If the crusting is yellow, it could be because of dried serum. And if the crusting is green or yellow green, it could be because of dryness or dried pus or purulent exudate. And if the lesion is brown or dark red, it's obvious it could be because of dried blood. So these crusting happen, you will see them happening only after injury or trauma. Now coming to the next lesion under this category, we have fissure. Fissure is a thin crack within the epithelium or linear cleavage. As you can see here, it's a linear cleavage or gap in the skin. It could occur because of trauma or excessive dryness, or it could be because of malnutrition. Now coming to the next lesion which are present above the level of the mucosa is a dental sinus. Dental sinus occurs because of long-standing abscess. Abscess we have studied it. This is a lesion present under the level of the mucosa. But why dental sinus has been classified under the lesions above the level of the mucosa is because the dental sinus is an abnormal channel that drains from a long standing abscess, and it originates or ends in one opening. As you can see in this picture, the sinus, it's opening on the mucosa. It's above the level of the mucosa. Now, over here, this is an abscess, and if it drains out like this over here, it usually forms a swelling, and this swelling is a dental sinus. Now, coming to the next term under this category of lesion which are present above the level of the mucosa, we have dental fistula. Dental fistula is a pathologic communication between the cutaneous surface of the face and the oral cavity. The passage acts as a reservoir of pus and other infectious discharge. Over here, you have an abscess, and if this abscess was draining here, we said it results in sinus, right? Now, if this abscess extends from here to the cheek region and all the way out, if this abscess extends like this, and you can see an opening on the cheek region, then it's known as a fistula. It's it's a pathologic communication between the cheek or any cutaneous surface or skin. Over here it is cheek, skin, or any cutaneous surface, and the oral cavity. Over here it's tooth. As you can see, it's a communication between these two, between the cheek, this is the cheek region, the skin. In the next video, I'll be talking about some advanced terminologies which we use in dentistry. I hope this video was helpful. Please like, share, comment, and don't forget to subscribe to my channel. And yeah, don't forget to hit the bell icon, as it will keep you updated with the latest videos. Thank you.